Nasal valve collapse. The nasal valve is actually the narrowest portion of the nose from the inside. It is about 1.5 centimeter from the vestibule, and it is caused because of narrowing between the cartilage of the lateral nasal wall and the cartilage of the nasal septum. There are two types of nasal valves: an inner nasal valve, which is the inner area of the nose from which we breathe, and an external nasal valve, which is on the outside surface of the nose and also formed by the outer lateral cartilages. The inner nasal valve collapses inward, particularly when we breathe in because of the negative pressure of the air, and usually opens up on breathing out. So the problem usually occurs while breathing in. So the inner nasal valve collapses while breathing in and opens up while breathing out, whereas the external nasal valve usually collapses both ways while breathing in or breathing out, and it is clearly visible. So though the inner nasal valve collapse may not be clearly visible to the naked eye, the external nasal valve collapse will be visible because you can see the indrawing of the upper part of the nose when the patient breathes inwards, and you can see how the nasal passage gets narrowed because of this. A nasal valve collapse is a fairly common condition, and it becomes more serious as we grow a little older because the cartilages become weaker. What are the causes of a nasal valve collapse? The causes can be either genetic, that you're born with a narrowed nasal passage and the nasal valve is narrow to begin with and can collapse over itself. A septal deviation or a nasal septal deviation can cause a narrowing in the inner nasal valve and also help to cause a collapse. Post-operatively, it is quite common to have a nasal valve collapse, particularly if cartilages have been removed or if that area of the inner nasal valve has been weakened by the surgery. Sometimes because of an infection like a nasal septal hematoma or a nasal abscess, which weakens these areas, can cause a nasal valve to collapse. Post-traumatic, if you've had an injury to the nose, these tissues can get damaged and become weaker so that the nose collapses upon itself on breathing.